With this procedure, our patients are able to forget that they even had a surgery. They look in the mirror and they see themselves, not a patient. So this is minimally invasive mitral valve surgery, and what's different about this is that instead of making a very large incision, a sternotomy in the middle of the chest, which cuts through bone and leaves a very noticeable scar, what we do is make a small incision. It's about 1.5 to 2 inches, and through that we're going in between the ribs, so we're not cutting any bone at all, and we're able to get in and operate on the mitral valve through that small incision. At the moment, Southlake is the only center in the GTA offering this procedure. So in that way, we're providing patients with the best care possible. This type of procedure decreases the risk of bleeding, decreases the risk of infection. Patients have a shorter length of hospital stay. Patients have told me that this procedure itself has actually allowed them to get back to their activities much sooner. And in fact, one of the patients that I spoke to recently was saying how after years since his initial surgery, he doesn't even think about it anymore. In fact, it doesn't even occur to him that he had a heart issue in the first place, and he is living his life as if that problem never existed. So that's the kind of feedback that we're getting, and he has no reminder of the fact that he had surgery, in that anytime he looks in the mirror, all he sees is himself and not a big scar.